1 in 5 people struggle with mental illness, and sometimes this includes children, with many people afraid to ask for help. And here in North Alabama, Wellstone offers crisis care, therapy, psychiatric, and community-based programs for all ages. So joining me live this morning is Wellstone Director of Development, Karen Peterson, and Children's Division Director, Tara-Lynn Tobias. Good morning, ladies. How you doing?
Good. How are you?
I'm doing wonderful. I'm so happy that you all are here. I want to give a little bit of a story first because Karen, you know, I reached out to you directly. I was approached by a father in Walmart a while ago, and he was letting me know that his son was diagnosed with bipolar disorder. And he was just telling me a little bit about his story and how he really just needed some help and support, and if I could do anything to just bring it to the table for a conversation. And so I was like, let me do some research myself and see if we can get some experts in here to talk about that. So I'm happy to have you guys here. Karen, start us off with a little bit more about the details on Wellstone.
Okay, well, I will, but a shout out to you first, because people can come up to you and ask you questions, and it's so easy to walk away and forget about it. So thank you for really taking that to heart.
Thank you. Thank you.
So Wellstone has been around here a long, long time. It was founded in 1969, opened our doors in 1970 as what people who have been here a while would know as the Mental Health Center. You know, we started with basically 3 programs, just your traditional outpatient, day patient, or outpatient, psychiatric, and therapy, and now we have about 80 different programs.
Oh my goodness.
And we are really committed to connecting our amazing community to health and well-being, and we do that through, as you mentioned, so many programs. We've got substance use programs, we have outpatient treatment for youth. We have inpatient treatment now for adults, and even safe medical detox.
That's wonderful.
So really something for everything across the spectrum and for all ages.
And some of those are even 24/7 care programs for adults and children that are facing mental health crises.
Yes, and that's been in the news so much lately, even just the past few years. And really that's how our CEO and leadership team, Jeremy Blair, has been really transforming mental health care here across North Alabama. We started with 988, which is here for your refrigerator. It is your 24/7, basically the 911 for mental health care. We have someone to respond. We have mobile crisis teams where they can go to schools and they can go to restaurants, they can go to homes, and then we have the 24/7 crisis care center. We saw the video a moment ago for adults who are experiencing those mental health emergencies and youth. In our first year for the kids, we saw over 400 children. That's 400 children who did not have to go out of state or out of county for that care. You know, that's adding trauma on trauma. So,
and to the family too. And literally some of the things that you're sharing is what the father was experiencing, because he said sometimes his son did have to go to certain locations that may not have been here immediately. So when you're talking, especially when we're talking about youth or students, why is that mental health, it's an illness not just for the person diagnosed, but also for the family as well?
Most definitely, yes. So when we have individuals, youth and adolescents who are diagnosed with a mental illness, it can affect the entire family. The youth specifically, because at one way they can say, oh, well, I have an answer on why I feel this way, why my mood can change at the drop of a hat. And then on the other end, it can be difficult because they can perceive it as something's wrong with me. No one is experiencing what I'm experiencing. And then from the standpoint as a parent or a caregiver, you may perceive that way too. Something's wrong with my child. What did I do to give this to my child? Or maybe even, well, now we have answers. Now that we have answers, what can we do to mitigate the symptoms?
What I would say is, with this situation, what we don't want to do is like play the blame game. You know, it's not about, well, what did I do or what I could have done. It's like we have the resources, so now let's use them. Are there any mental illnesses that you're seeing in children more often or frequently?
At our location, I would say mainly ADHD. ADHD.
Okay.
And then secondary to that would be depression, because peer pressure is a thing.
It is. Yes, it is. Yeah.
So our kids come in to see our outpatient therapists as well as to get services from our other programs to address that.
Awesome. I'm so glad that is there. And like you said, peer pressure, it's been around. It's nothing new. Peer pressure has
Right.
been here for ages, and it's not going anywhere, especially with social media now playing a factor. What do you think are some of the biggest challenges in addition to, you know, things like peer pressure for our youth today? Is it things like speaking up or feeling confident in coming to an adult? What are you seeing?
In addition to peer pressure, I would also say self-esteem. Sometimes we experience low self-esteem and we don't know why. We don't know where it came from. So really just tapping into yourself and really being able to be confident, get high self-esteem. Of course, that can come with therapy, that can come with positive self-talk, and we address that in therapy, just encouraging yourself and gaining the information and knowing I am who I think I am.
Yes, and this is also going to go to the community as well, because it's also our job to help eliminate the stigmas surrounding mental illness for both children and adults. So what can we do to play our part in the community for that?
I would say normalize the conversation. It was 23 years ago, and I was actually working at a local TV station here when I went to treatment for alcohol addiction. And I was mortified. I felt like a failure. I was enrobed in shame. And I went off for 2 weeks, came back, didn't tell anyone where I'd been. It took me a long, long time. So I think we've come a long way. But by sharing our stories, by talking about it, we can let other people know that, hey, it's okay. You're not alone. That is the biggest message. We want people to know that there are amazing mental health professionals like Terilyn and her team and others at Wellstone and others at private practices as well. We are a great community of mental health care providers, and there are programs for just about everyone in here.
Well, first of all, you commended me at the beginning. I'm going to commend you here at the end. Thank you for being open and sharing your story as well. And then reaching back and helping others, because that's what this is all about. Once again, community. So thank you, ladies, so much for starting this conversation, but hopefully it will not be the last time we see you here on Day Today.
You're delightful.
Thank you. Thank you so much. We're going to have some links for Wellstone on our As Seen on Day Today page. If you or someone you know is in need of some of those programs we mentioned today,